Welcome to the Fibromyalgia Podcast. I'm Tami Stacklehouse, fibromyalgia coach, author, and founder of the International Fibromyalgia Coaching Institute. The goal of this podcast is to empower you with access to the dream team of experts and coaches I've discovered are key to living the fibro life you love. From the comfort of your own home, and maybe even your pajamas, I'll help you take back control of your life and health. To help out with fibro fog, I always include full show notes and additional resources at fibromyalgiapodcast.com. Welcome to the Fibromyalgia Podcast. I'm your coach, Tami Stacklehouse, and this is episode 105. Today's episode is an interview with Dr. Andrea Chadwick. Dr. Chadwick is the medical director of Swing Care, a new telehealth clinic specializing in expert, holistic fibromyalgia care. She's also the director of the Fibromyalgia and Centralized Pain Exploration Lab at the University of Kansas Medical Center. In today's interview, we cover a bunch of things, including how Dr. Chadwick began treating fibromyalgia patients, what research her lab is working on, and things you can do to communicate better with your doctor, particularly if you're seeing a new doctor for the first time. Dr. Chadwick is double board certified in anesthesiology and pain medicine, and her clinical experience focuses on complex centralized pain syndromes, including fibromyalgia. And make sure you keep listening after the interview. I have several resources I use to help my clients prepare for their doctor visits. I'll show you how you can access those resources after the interview. You can also go to today's show notes. Just go to fibromyalgiapodcast.com/105. All right, welcome. Hi, Dr. Chadwick. Thank you so much for being on here. I'm excited to talk with you.
Thank you so much for having me. I'm looking forward to talking with you as well. Thanks for having me here today.
Awesome. So I know we're going to talk about how to have some good conversations with your doctors. But before we do that, I would love for everybody to just kind of meet you.
Absolutely.
Yeah. How did you get into working with fibro patients? You and I were just talking before I hit the record button that you kind of have to have a little bit of a calling when it comes to fibromyalgia.
Absolutely. I will say when I was in training, just for the audience here, I was classically trained to be an anesthesiology pain management provider. And so typically speaking, our repertoire is medications, but mostly interventional procedures like epidurals, et cetera. So it's one of those things during my training where I had no idea that this was going to be my life, like whatsoever. If you had asked me in 2009, I would have been like, I'm going to do injections. It's going to be awesome.
Right. So you'd be then the person who would do the trigger point injections
all of it,
that we
yes.
might get. Yeah.
The ablations, we did stimulators. I mean, it was all of the things and I enjoyed it. I really did. But even during fellowship, I found myself very interested. And what took me out of anesthesia into pain was just the idea of a patient journey and a patient story and being a part of that. I really didn't like just putting people to sleep. I found myself wondering what happened to them after their surgeries. And everybody's like, why do you look that stuff up? I'm like, I really want to know where their life went. And so chronic pain really spoke to me, just being able to be a part of someone's life and following their journey and helping them along the way. So it's a little bit of a joke. Like I have a slide when I lecture. It's like, I didn't find fibromyalgia, it found me.
Mm-hmm.
It's one of those things. It is a calling. And I just started seeing more and more patients with it because I would accept the patients. I wasn't one of those providers who would say, absolutely no fibromyalgia patients. I found that I enjoyed speaking with people who were suffering from fibromyalgia and teaching them to change that suffering to living. That's a really positive journey to be on. And so it just kind of morphed over time that I started seeing less and less of your typical spine and neuropathic pain, CRPS patients to more and more patients with fibromyalgia and other centralized pain syndromes like migraine or TMJ or chronic low back pain. So it's been a process of about 14 years to get here, but I will say, as you said, I feel that this was kind of a destiny thing for me because not
Mhm.
only did it change the way I practice clinically, but it really also informed my other passion, which is research.
I love it. So, speaking of research, you've got your own lab, you're doing some research. So, tell us about that.
Absolutely. So I knew from the get out that I wanted to do research when I became a clinician, that just going into private practice and seeing patients day in, day out would be fulfilling in some way, shape, or form. But I knew I wanted to do studies that would impact patients' lives in a positive way and move the needle, right? Like getting data that helps advance medical knowledge is really, really cool. So when I was a fellow at the University of California, Los Angeles, I did a combined fellowship with a research program. So I got a master's in clinical research at UCLA in hopes that that would then translate to my ability to perform really well designed and well conducted research. And so since that time, I've just been morphing my research program to advanced concepts of centralized pain and fibromyalgia. My lab is called the Fibromyalgia and Centralized Pain Exploration Lab. Our acronym is the FACE Lab, of which our goal and our mission is to put a face to invisible illnesses. So all of my research projects, whether or not they are specifically on fibromyalgia, they all have concepts of fibromyalgia and fibromyalgia-ness to them because, I mean, if you ask those of us who do the research and read a lot about the topic, we know that most chronic pain syndromes at their core have that level of central nervous system pain amplification going on. So I always talk about fibromyalgia. It's yes, it is a discrete disorder. There are diagnostic criteria, but the amount of fibromyalgia-ness or brain activation and sensitization can exist in most chronic pain syndromes. So I could probably study just about every chronic pain condition in
Mhm.
my lab, and it would still be some sort of fibromyalgia centralized pain spin.
Right. Plus, there's all the stuff that, like if you broke fibro down, we've got bad sleep, we've got that amplification of pain, we've got the fatigue issues, right? Like there's all these things that kind of go together to make the recipe of
Absolutely.
fibro. So,
And they can be very common in other chronic pain conditions too.
yeah,
So, if you look at the 10 chronic overlapping pain syndromes that the NIH recognizes, migraine, temporomandibular disorder, endometriosis, chronic pelvic pain, irritable bowel, interstitial cystitis, these all have been shown to have those same symptoms. It's just that when it comes to fibromyalgia, we talk about it as if it's kind of like on a spectrum, and fibromyalgia is like that end pathway of where it's just widespread and the symptoms are more severe.
I always think of it like we might have pain, and then, like, somewhere in the brain and our central nervous system, like a switch gets flipped. And then
Absolutely.
now we're responding to everything in this fibro way that wasn't happening before.
Oh, 100%. And I see that all the time. I mean, it's never usually a gradual thing for most people. It's there may have been an inciting event or some period of a stressful time in your life, but for a lot of people, they don't really recognize those symptoms. It is kind of an aha light switch moment where you're just like, wait a second, I'm like globally hypersensitive.
Right.
I don't remember what happened there. But, I think it's important that clinicians and patients tell their stories because I will say, in just about every patient I've ever seen with fibro, or whether they have the diagnosis or not, there is a key in that history that I'm able to gather from just giving the patient a sounding board to tell their story, where I can say, aha, I think I understand why this happened.
Mhm.
Or it could be a variety of different things, but everybody's story is different and everybody's pathway to fibromyalgia is different. It just takes a good doctor to lend an ear and take those little, what I call pearls from the story to help put those in your brain. Oh, I think we know what's going on here.
Right, right. And you guys are doing some cool research right now. One of the things I think is so fun about research is that it often will give weight to the things that we already knew as patients, right?
Totally.
So you are doing some research on heat with fibro, and I think pretty much any fibro patient would tell you exactly where their heating pad is and when they last
Yeah.
used it.
Right. Well, and it's true. So I take a lot of inspiration from what I hear in the clinic. And it's actually a funny story about how this study came to fruition. So I was at a local research symposia where I work, and this woman who does research in animals, like hang in there, it's going to get to the humans. She showed her research and she had a little screen of some animals that were anesthetized sitting in like a hot tub, like a little animal hot tub. And she was speaking about these proteins called heat shock proteins and how they are released in the body. And when they are, it has cardiovascular, metabolic, but also inflammatory pathway changes that overall improve the health and decrease the inflammation in the animals. And so I went up to her after her talk and I was like, this is going to sound really weird, but have you ever thought about partnering with a clinician to do research in humans with heat? And she was like, that's really interesting. You say that. We just bought a hot tub for use at our clinical research center. And so within 3 weeks, whipped up a grant, submitted it to our institution and got internal funding to do what we call translational research, which means not only do we care about the clinical parameters that patients may experience from an intervention, but we actually looked at some of those proteins and biomarkers in the blood to correspond with our clinical data to really identify, okay, so if this is working, why? Because I think that's a lot of answers that we don't get from conventional research in fibromyalgia, especially, is we can do these interventions, but sometimes the patients are like, do you know why this is working? I'm like, no, I'm not exactly quite sure like which pathway this is hitting that made you feel better. So it was really cool to do this research. We put 8 patients through. Unfortunately, COVID put a wrench in our recruitment plans. Turns out people don't want to sit in hot tubs in a mask. I mean,
Can't imagine.
that would be horrible, right? It's a very hot process. So it's an intense regimen where people come in 3 times a week. They're in the heat for about 45 minutes and they do it for a month. But what we found in 8 participants was that they had statistically significant improvements in their pain scores just after 4 weeks of the heat therapy. And to find significance with only 8 patients means that it's a really positive signal, because typically speaking, you need a bigger sample size to have significant findings. And interestingly, we were able to analyze the blood and do some other physiologic testing. And it looked like patients' pain sensitivity was trending to being less sensitive using some
So not just
specialized tests.
changing how you feel in the moment, but how you're going to react to future
Exactly, like
things.
your body's overall sensitivity. And
Yeah.
then we saw these really ramped up levels of heat shock proteins, which identified that, hey, we can do this in humans too. And so we're really looking to do this project on a larger scale. But I think it validates what patients experience when patients come to me and they're like, the heat makes me feel better. And now I can be like, we're going to understand why. And it's really fun to take what patients tell me and marry that with good quality research, because I have been able to tell patients, listen, here's how we did our therapy. And if you have access to a hot tub or even just a hot bath, try doing this more regularly. And I don't have the data to back this up. And this is, again, what we'll be doing in future studies. But I'm very interested in how this may be almost like a surrogate for exercise. Because if you think
Oh.
about it, when you're in that heat, your heart rates gets elevated. We were monitoring vital signs the whole time. People felt tired after they would do some of these heat therapy treatments. But I believe it's almost like a surrogate for physical activity. And what we found was just, anecdotally, what patients would tell us is towards the beginning of the study, the heat would kind of zap them out, but they turned a corner after about a week and a half to where they actually felt really energized after the heat therapy. They were sleeping better. We had statistically significant improvements in sleep and fatigue, but they noticed that they were actually able to physically do more.
So it might be a really interesting, like, getting started, right?
Yeah, like
Yeah.
a bridge, especially for people who maybe, and I'm sure you've heard this with some of your listeners. It's just like, well, how can I move when it hurts? Right.
Right.
So
Right.
is this a way to kind of ease a person who's maybe been more sedentary or gets that exercise induced increase in pain Is it a way to kind of ease them into that physical activity and promote that low to moderate impact exercise? And I don't even like the word exercise, like activity or movement regimen. I think so, but we'll need more research to tease that out.
I love that. I love that. The other thing I really like about like digging into why is this happening is that I think so often, particularly with fibromyalgia, things kind of get put in that placebo effect category, right? You just think that hot bath is going to help, right?
Absolutely. And again, we'll need to do a randomized controlled trial where we probably have to put people in like lukewarm water, which kind of sucks. But, we do need to have those control groups to show that it truly is an effect. But what we saw was so profound. And I think just the stories we hear from people who use heat as a viable source of treatment for their fibromyalgia that, I don't really see a placebo response here. We had a patient who was barely able to walk. And at the end of the study, she was walking her dog with her husband for the first time that I think she had done in years.
That's
So
awesome.
again, small amount of data, but it's really promising. And I think I would urge the listeners here, when you're talking about advocacy for fibromyalgia and fibromyalgia research, to really be vocal with your local representatives who have the ability to inform policy and funding in our capital, to really put a voice that fibromyalgia research needs to be supported by the National Institutes of Health and other big funding agencies, because 2 to 8% of the population, this is a huge public health issue. And unfortunately, until that fibromyalgia word gets in the ears of our lawmakers, they're going to continue to prioritize other medical conditions over chronic pain. I think we've made some headway with the opioid crisis, and they have earmarked a lot of dollars for chronic pain, but specifically fibromyalgia, we need your voices up on Capitol Hill to help promote the research for fibromyalgia patients.
And you were telling me that you've done a lot of fibro research that wasn't under fibromyalgia. And I think one of the big problems with that is it just sort of keeps perpetuating this situation where nobody really knows. It might be hard to get disability or have things covered under insurance because
Absolutely.
it's this unnamed, unseen.
Like it's like he who shall not be named, or the artist
Right.
formerly known as Prince, but it's like I've had to use other terms to describe what underlies central or fibromyalgia, such as centralized pain or nociplastic pain. We have to kind of package it because it does undergo peer review, and we don't know what type of potential biases or what information a reviewer might have. And so by packaging it in a little bit more of a broad sense, does tend to help things get funded, and that's fantastic. But unfortunately for me, it's like that visibility, the validity piece, that validation that this is a condition, this is the name of it, and it doesn't need to be viewed as, well, if I write it with fibromyalgia or I write it with centralized pain, it's the same thing, but I shouldn't have to take out the actual diagnosis.
No, because that just keeps meaning that like the next person can't use it either. You know what I mean? Like
Yes.
it doesn't ever change.
So, and this is something we were talking about ahead earlier, is like there's, generally speaking, not a home for fibromyalgia in the medical
Yeah.
community. And I think the same holds true within our funding institutes at the National Institutes of Health. Is some grants might go to one institute, some grants might go to another institute, and you have to almost write the grant to fit an institute. Whereas it's like, if you're going to submit an Alzheimer's grant, you know which institutes that's going to go to, or a cancer grant. But with fibromyalgia, it's a real kind of a shot in the dark, and you just kind of hope it gets put somewhere that they likely to fund you.
Right.
I've been lucky so far, and I pair with some of our nation's leading experts in fibromyalgia, like Dr. Dan Claw up at the University of Michigan. So I've been successful, but again, I really hope that as the years progress, that we see higher priorities for funding fibromyalgia research, to where we actually can just put that face to that name.
Yes, definitely. So I'm going to switch gears. You are here to help me help our listeners. How do we have better conversations with our doctors And to be honest, I have conversations like this all the time with my students and clients. I've got a doctor's appointment coming up next week. These are the things I'm concerned about. How do I make sure they don't think that I'm just after some drugs because I don't actually want drugs? I
Yeah.
just want to feel better. So, how do we do that? And I would love to hear some tips from you and just some ideas for ways we can do that better.
Absolutely. So, one thing I always advocate for when I'm seeing my new patients, or if I'm even seeing my established patients within clinic, is really focusing on the in between. So, I always tell my patients because they'll come in and they'll see me and they're like, I'm really great today. I'm like, that's fantastic. But how have you been? And then oftentimes they'll just be like, well, I think I've been okay. Or, I had like one bad streak, but I couldn't tell you how long it is. And I'm fine now. So I don't think we need to change anything. But then lo and behold, like they've actually been in a flare and they were just having a good day. So
Mhm.
I always talk about journaling that in between because I feel like it's that time when I'm not there with the patient that I need to know about. I can
Yeah.
take you in the right here and now, and we can have a discussion about your today, but it's so important to have that idea of how have you been functioning since I saw you last? Or if this is a new patient consultation, tell me your whole journey. I just want to hear it all.
You know what you're asking when you ask that.
Yes. And I realize that involves seeing a provider who's going to give you that time to talk. But I feel like, especially, let's say you're going to see a new pain provider or a new fibromyalgia specialist, some of the tidbits and pearls that a good fibromyalgia or a pain provider is going to ask about really involves that journey, but you might be able to piece it out and have it written down about like when your pain journey started. So
Mm.
oftentimes I say, take me back to when it first started. It could be in childhood. It could be you remembering in adolescence that this happened. It could be that you were fine until you got COVID-19. I mean, there's a whole host of start points, but I think it's always good to start at the beginning and then tell your story. And so that start point, and if there was any bits of information around that time in a person's life that may indicate why this could have happened. Maybe it was, well, I had migraines and tummy pains that were unexplained when I was a teenager and I was doing fine until I hit college and then I got mono and then boom. Those are the
Oh, yeah.
stories. So I think it's good to just map out that pain history from when it started and then any changes that occurred since then. So if it started with migraines, but then you got irritable bowel and then you had mono or Lyme disease, or then you had XYZ, it's important to point out all of those little tidbits of information. Think of it as like a timeline. Like if
Mhm.
you had to make a pain timeline, that would be, I think, a really helpful start because we all recognize clinicians are busy. Not everybody's as lucky as I was when I joined my practice to where I was literally like, I need 30 minutes to an hour with my new patients. And you cannot schedule anybody else during this time, no double booking. And if I need more time, my other patients will wait and they will understand because they'll remember I gave them that time at
Mhm.
the beginnings. But not all providers have that luck like me. So coming in with that concise timeline is really helpful. And then I will say some of the other things that would really help a provider be able to kind of focus their time on prospective, like initiative based conversations is what you've tried already. So I
Mhm.
spend a lot of my time kind of just having to rehash the past with the patient. Have you seen a neurologist for your migraines? Have you gone to GI? Did you go to rheumatology because you have a family history of lupus? All of those things is important. Under your timeline, put a little box of specialists I've seen before and why. And then the next step would be treatments I've tried.
Mhm.
And then break it down even further than that. Have you tried physical therapy? Have you tried aquatic therapy? So those are like physical treatments. Then you could look at, have you tried behavioral interventions, whether it be cognitive behavioral therapy or acceptance and commitment therapy. And then most importantly we are in Western medicine, here is the medications
Mhm.
that a person has tried, because at least within my clinic, I work in a tertiary care center where by the time I've seen someone, they've seen a lot of doctors.
Right. So they've tried a lot of things.
Yes. So It may be hard to remember again with fibro fog. I do recognize that sometimes patients can't remember what they've tried because they've tried so many things. And so oftentimes that medication piece is where I'll go through literally like every name of every drug to just say, hey, have you tried it? And if you did it help? Yes, no. If it didn't help, did you have side effects? Like, why did you stop it? And so just even those sections of timeline and who you've seen and what you've tried will really help focus a doctor or a clinician on what they can do that's different. How are we going to shift the needle from what you've tried before? Because there's no reason to reinvent that wheel.
Mm-hmm.
But I find that once I'm able to kind of get that information, I'm able to say, here's how I think you got fibromyalgia. And I like to do that. I like to pick out those pearls and say, here were your risk factors. And this is how I think things played out for you developing this condition. And then by looking at what they've tried, I can see little gaps, right? I can see maybe they've done physical therapy, but maybe they did like really aggressive land physical therapy. So we should order aqua therapy. Maybe they haven't tried cognitive behavioral therapy or acceptance and commitment therapy. We can refer for that if I think they need that type of treatment. I mean, most fibromyalgia patients benefit, or any chronic pain patients can benefit from that type of therapy. And then for the medication piece, it's finding the holes and using what they have and haven't tried and coupling it with their current medication regimen, because we want to avoid drug-drug interactions. And then something I've talked about a lot with not only my patients, but when I talk about the general dogma of fibromyalgia practice, it's this concept of shared medical decision-making. Okay. Yes, I understand fibro. No, I'm not a fibromyalgia sufferer, although I did tell you I have migraines and TMJ. So I'm like slightly fibro. It's important, I think, for physicians and clinicians to partner with their patient, because you know what? I can recommend things, but it doesn't mean it's right for someone's life. So having those discussions of what the risks and the benefits are of all the potential treatments, and finding out, kind of meeting the patient where they're at and making a decision. Well, like if you've tried so many meds and you're scared of side effects, like let's talk about these non-medication options. Or maybe they want to try a bunch of different options. I kind of leave that in a shared space with the patient for where they feel comfortable at.
I love it. I love it. A lot of the things that you've just talked about is a lot of the work that I do with clients as a coach, right? It's just kind of walking through their lives, right? One of my clients, she used sticky notes. So for you listening, if you feel like you want to create this timeline, she used sticky notes and she would just like write down everything that she could think of. And then she put them into the timeline, because trying to think like chronologically, our brains don't
Hard.
always work that way.
I can barely remember what I ate for lunch this weekend. So yes, sticky
Yeah.
notes is a great idea.
And start keeping your records too, right? If you have a document and you can just go in there when you're prescribed something new and just make a note when you started it, why you're taking it, and then maybe when you stopped it and why you stopped taking it, then you've got everything you need to print out and take in when you have a doctor's appointment.
Absolutely. And I think something a good clinician should ask, but also I think something a patient, and I have had patients come to me with kind of like their goals. What do you, as the patient, want out of this therapeutic relationship?
Mhm.
Because I can prescribe medications till the cows come home, but if it's going to make y'all worked out and you can't think straight, and that's not in line with your values as a human, then we're going to have a problem there. So I think it's important to have those goals, kind of expectations for therapy ahead of time, knowing that our goal with fibromyalgia care in general is, to just reduce symptom burden and improve quality of life.
Yep.
At the end of the day, if I could cure fibro, like I'd probably be sitting on a beach in Italy right now, but I'm not, because I can't cure fibro. But what our goals are is a shared pathway towards honoring the values you have in your life, and how management with a variety of different therapies can help those goals be met and values be kept and expectations be clear. I think just from both sides about, hey, like these are my limitations. This is what I want. And I feel like physicians kind of have the same. I mean, we have only so many drugs we can try, right? There's only so many FDA approved medications. Heck, the most of what I prescribe is off label because it's not even
Right.
FDA approved for fibromyalgia.
Yep.
But coupling that with, is the goal to be running a marathon, or is the goal to just be able to like play with your grandson and do that in a meaningful way? And I think always having, because everybody's different, having those open conversations is I think it just creates a really great therapeutic relationship.
And it may change what you do too, right? Like if your goal is to run a
Absolutely.
marathon versus, being there for your first grandbaby, like there's different things we need to do to accomplish that, right?
Absolutely. And maybe also just recognizing that maybe marathons aren't great for every fibromyalgia patient. I'll work with you to get there, but I'm very clear with patients that, I think there is a lot of space for grace. I always say that. That's one thing I say in my clinic is there's space for grace, because when you have fibromyalgia and you're trying to do your best, I oftentimes feel like people can be really hard on themselves. And I'm sure maybe you can pontificate on that with what you've experienced with your clientele and the patients you work with. But I personally think my fibromyalgia patients are oftentimes some of the hardest people on themselves
Mhm.
because they remember what they used to look like, right? And where they are now. And it almost seems like a Herculean effort to get back there. But like, what if the needle isn't that person? What if it's a new normal? And so
Right.
establishing how can we get you back to a place where you feel like you again, even if that you is not the person you were in college or in high school. I think you're nodding your head.
Oh
So do you
yeah.
have those experiences with patients too, where they need to have some space for grace?
Absolutely. And I was actually just thinking that there are lots of things in life that cause us to not be able to get back to that person that we remember, right? Age will do it, having kids, getting married. There can
Close
be
to menopause.
but all of those things, it changes our bodies, it changes our brains, it changes
Yep.
our lives, right? And for some reason with fibromyalgia, we think that it shouldn't change us. But yet, as we get older, I'm having a senior moment, right? But that's not okay if it's fibro.
I know. And it's such a conundrum and something I do think a lot of those behavioral therapies. And again, like I want to specify for the people listening right now, when I say things like psychological interventions, I want to make clear that it's not because the pain is in your head. That is not what
No.
I'm saying at all. And I want to make that clear because I know a lot of people who may be listening to this get told it's them that it's in their head. And I'm here to say it's not. What we know about chronic pain and fibromyalgia sufferers, again, because the people who get this are generally like young, healthy people, right? So it is hard to not accept that you're still you, right? Even if you have fibromyalgia, that you're still you. So a lot of those behavioral, psychological type practices like CBT and ACT are really aimed at, I think, given that space for grace to say, listen, I'm still me. I just have fibromyalgia and I can become the best me. I just have to figure what that looks like.
Right,
And
right,
what is
exactly.
that? I don't want to say regimen, but like program. What does my program look like for me to be able to live my best self as me, the new normal, right?
Which we hate that term too, right? New normal,
Right?
because it usually means, okay, your life is going to suck and you have to accept it.
Yes.
But that's not really what
No.
it means.
I think, again, it's just this idea. I mean, I gained 30 pounds during COVID, right? I
Right.
think it was probably because I was taking Zoom calls in sweatpants, right? And
Right.
like, and we were bored and I was sad because I didn't get to go and travel and do all the things I enjoyed. And so, I've been on a weight loss journey for, better part of a couple of years now. And I have to keep reminding myself that I'm bigger than a smaller pair of pants. And that's one of my favorite Peloton instructors says, but I feel like it's really helpful to think about it, even if it doesn't have to do with weight or size, right? The fibromyalgia doesn't define who you are. Like you're still the same you. It's just finding the version of you that works best in your fibromyalgia body.
Right. Right. Exactly. Who are you now? Yeah.
Absolutely.
It's so funny we're talking about this because our last episode was all about this exact topic. So for you listening, go back and check out 104 if you want to dig into that a little bit more. But we have a little bit of identity crisis that happens. We have to figure out, who am I now? And when you have a good doctor on your team, that is a whole lot easier.
I think something I'm sure the listeners have probably seen doctors that they felt were validating and good and open and receptive, and probably some not so much, right?
Right.
And so I want to, validate people's experiences, knowing that not all encounters with clinicians are going to be exactly going to Disneyland. It's not going to be all sunshine and kittens. I don't think that should discourage people, because I do
No,
believe, and I'd like your input, is sometimes if you have a bad encounter, you just have to accept that for what it's worth and move on until you find someone that is a better fit,
absolutely. Yeah.
because it's so
I
important.
always use the example of, we need to, don't take this wrong since you're a doctor, but we need to treat doctors a little bit more like we would restaurants, right? If you go and you have a terrible experience at a restaurant, you don't go back, you post a negative review, you tell your friends, right? And maybe that restaurant goes out of business. If you have a bad doctor experience, like if you truly are seeing a bad doctor, and nothing pisses me off more than hearing stories like that, and I hear them way too often,
So do I.
we should do the same thing. Like that's how we as patients can change medicine, right? Like voting with our dollars, voting with where we make appointments, and not just accepting that I have to be treated this way, otherwise I can't get help. Like that is
Absolutely. And
such a
there's
lie.
nothing more disheartening, I think, as a clinician. I mean, I've witnessed this firsthand, right? I am privy to other providers' notes when I refer people places. And when you see things that are highly invalidating in someone's notes, I have been known to contact said provider and provide education and perhaps
Yay.
some gentle correcting about why that's not okay,
Right.
because there's no room for opinions in a medical consult.
No. Yeah.
And so I encourage patients that if there are statements or opinions or, things within a note from a provider you've seen, that it's your job. And like you said, it is the job of the patient to, in a sense, kind of correct that behavior. And I've encouraged patients to make phone calls to patient relations, call offices asking to discuss about why certain things were written in a note a certain way, or flat out challenge them, because there, again, is no reason for a provider to put their own emotional musings about how they interpreted a situation in someone's note. I'm very objective when I write my documentation. I also think making sure that your provider has good documentation so that you can, review your notes and know exactly what your doctor has planned for you.
Mm-hmm.
So that's something I've always taught our fellows when I'm teaching, or residents, is, your note is everything that happened. So the patient tells me the story, I need to put the story on paper. Then I need to put the story about what we talked about in terms of treatment on the paper. And so all of my patients are always super thankful. Again, with, fibro fog, sometimes they leave an appointment feeling completely like they did not absorb anything. By my notes, they're able to go in and say, that's what we talked about. That's the
Right.
plan. Okay, I remember now. But I think
Yeah.
making sure that the provider you choose to engage with is also very smart and good about their documentation, because in the long run, that helps improve your treatment outcomes as well. Because if you read a note and you have no idea what they were thinking or why they chose this medication or what the next step might be or what provider they wanted you to see, I think patients can leave feeling like, am I being
Right, exactly.
what's happening with me?
Exactly, exactly. And you are actually part of a really cool thing that's getting started that will hopefully help fibro patients get connected to better doctors. Tell us a little bit about swing care as we wrap it up.
Absolutely. I cannot tell you, it was just the serendipity of me becoming a fibromyalgia doctor is about the serendipity of how I got involved with this wonderful new telemedicine service called Swing Care. So I had engaged with some people who were doing some really cool stuff in the fibromyalgia space and eventually started consulting with them about what a virtual telemedicine practice for fibromyalgia could look like in terms of my treatment paradigms coupled with evidence-based care treatment pathways. And, about a year and a half later, here we are. We developed Swing Care. It is currently launched in the state of Texas. And the whole mission and why I got involved was just like we talked a little bit about before, fibromyalgia not really having a home within the
Mhm.
research sphere. I'm sure you and patients who are listening recognize that fibromyalgia really doesn't have a medical home either.
Right,
It's
right.
oftentimes, if you have hypertension or a heart failure, you're going to see a cardiologist. Or if you have diabetes or thyroid problems, you're going to see an endocrinologist. But fibromyalgia patients don't have that medical home. So we aimed with developing Swing Care to basically have that place for people to turn to for chronic fibromyalgia care in whatever way that looks right for them. So we've really tailored this again to be very much patient centric, but driven with shared medical decision making. It's essentially my dogma for practice coupled with our advisory board's input and best practices based on high level evidence care. We've been able to build this virtual clinic and it's so exciting. And I'm just thrilled to be involved as their medical director.
That's so cool. And let's face it, for fibro people, a virtual clinic is perfect, right?
There are certain things we can't do physical
Absolutely.
exam wise in a virtual space, but for all intents and purposes, when it comes to fibromyalgia, the currently accepted diagnostic criteria are all on a self report survey. And I can have patients kind of touch their bodies and see if they have that hyperalgesia, which is exaggerated pain to a painful response, or that allodynia, which is pain to a non painful response. So, in a sense, I'm still able to examine them in some ways, or like when I see my patients in telemedicine practice, but within Swing Care, they are able to do that as well. So, and I think there's something again about meeting a patient where they're at. What better place to do it in the place where the patient is legitimately at? It's a really
Mhm.
nice model for care. And I think patients have reported to me, at least, and I don't know if you've heard this with your clients, that telehealth almost helps take out that anxiety piece of having to come into a physician's office. There's all the rigmarole of getting checked in and having to park your car and walk in, and maybe you go into the wrong suite or whatever. That being able to just like open up your laptop or your tablet or your phone on your couch or wherever you want to be comfortable doing it, that I think it takes a bit of stress out of the encounter. And so patients may be more apt to be able to tell their story, their timeline, all of those things we hit upon in a way that's less threatening to them,
Mhm.
that they're in their turf and able to
Right.
tell their story in the comforts of wherever they're at.
Yep, that's great. When I started coaching, I had decided right from the get-go that I was going to do it virtually. And the biggest reason was that I knew that like the day that my clients needed me the most was the day that they needed to be at home on the couch in their
Yes.
pajamas, right?
Yes, absolutely. And again, it's that in between, right? So, like, oftentimes in the in between, when I see patients in person, their in between is at home on their couch or
Right,
whatever
because if
they're doing.
they were really feeling terrible, they would have rescheduled their appointment, right?
100%. 100%. So, it really does allow a better, I think, snapshot of where a person's at to be able to do it, just like you said, when they really need you.
Mhm.
So if
Yep.
they're having a flare day, I mean, I've done telehealths where a person's literally in the dark. There's like a tiny light. I could barely see them because they have a migraine. But it's actually, I think for me as a physician, like, I'm sad to see someone, but it's almost like now I can see
Right.
like
You get a
what.
window into their real life in a way that you wouldn't if they had to come see you.
Absolutely. It's eye
Yeah.
opening. And I think also there's a propensity when people come into the clinic to just want to put on that good face. Like they've put on their clothes, they've put on some makeup, and they come in and they want to report all the good things. It's been, I think, a really big eye opener to see people at home and for them to just feel safe in their home, to be honest
Mhm.
and very much open up about, you know what, doc, like it's been really hard for the last 3 weeks and we need to talk about something different for me.
Right.
But I'd rather have that
Yeah.
authenticity instead of patients feeling like they have to put on a brave face. So
Absolutely.
I think if there's one like beautiful thing that came out of the pandemic, it's that things like this have become so easy, and telemedicine just, I mean, it was amazing how fast it got set up. And then now here we are. And I think it's honestly revolutionized the way that we can practice medicine.
I totally agree. It's definitely one of the gifts that came out of that for sure. Now, I know almost everybody listening is not in Texas. So, what would you say to those folks? What's happening next for them?
So we are establishing expansion to other states. One thing patients can do is go to www.swing.care. We do have a little place on there where you can click and say, I'm interested in swing care coming to my state, put where you live so that we can really understand where a lot of patients are coming from. I mean, our goal eventually is to be in all 50 states, but we're growing as fast as we can. And our ultimate goal at the end of all of this is to reach all of the fibromyalgia patients in the United States.
Which would be so amazing. I mean, I work with my clients virtually. And so I always have people who are looking for good doctors. And, if you're in Portland, I've got good ideas for you. Like I've got little pockets,
Right?
but like
Pockets.
not everywhere. And Portland doesn't help Southern Oregon, So
Right.
I'm really excited about what is happening there. And I'm looking forward to more than Texas.
Absolutely. And I think you made a good point. A lot of Americans live in rural areas,
Yeah.
they're not in big metropolises. So, one thing that I really enjoy about the concept of swing care is that we can access these underserved areas, people who are in parts of the country where they definitely don't have a fibromyalgia provider. And think
Yeah.
about it, if you're in Southern Oregon, I mean, getting to Portland may take a couple hours at least.
Yeah. It's
And
probably a
that,
good 6 in
yeah.
some
So
places. Yeah.
to expect a fibromyalgia patient to be in a car 6 hours one way, and that's a lot for a person. So to be able to reach people that otherwise would not be reached, I think is another wonderful thing, just besides creating the medical home.
Mhm.
I live in a state where we have a lot of rural areas, and it's been awesome to be able to expand our access to care through telemedicine.
That's awesome. Well, I'm sure you and I could keep talking,
So yes, we
but
probably need to do this again.
we will definitely
Just
have to do
saying.
this again.
I enjoy talking with you.
Yes, you too. As we wrap up, I would love for you to just take, a second and talk to that person who's listening who is like just really struggling to find good doctors. Talk from your doctor heart to them.
So, from my doctor heart to you, I mean, the one thing I tell anyone who might be suffering from this or is suffering from this and feels downtrodden to just don't give up. I mean, there's hope. There is hope in the form of swing care, and eventually that will expand. But I think there's hope that the knowledge that is out there that you create with your webinars and your podcasts, all of this is power. Information is power. So hopefully, with what we've talked about today, coupled with all of the other information you can get from your podcast, coaching with you, and other sources, that people can take that knowledge and be empowered to go advocate for themselves to get better care. And I will leave with kind of the statement I give all of my patients, which is there's only so much I can do. I always say, I'll give you an inch, but the yard or mile has to come from the patient.
Mm-hmm.
So, and again, it harkens that in between. It's fibromyalgia. Getting better can be a process, a journey. I mean, it's just a journey to get fibromyalgia. It's a journey to get that healing and that improvement in a person's overall health and well-being with fibromyalgia. So trust the process, and more importantly, trust yourself.
I love it. Thank you so much. And thank you so much for being here. Appreciate all your insight.
Thank you so much.
And for you listening, just hang on a second or two more. I want to give you some resources that I use with my clients as they're preparing for their doctor visits. I'm going to tell you how you can get your copies. And that wraps up my interview with Dr. Andrea Chadwick. If you're interested in learning more about how you can work with your doctor better, check out Chapter 7 of my book, Take Back Your Life. Along with the tips shared today by Dr. Chadwick, I have also got a bunch of suggestions from my own life and my work with my clients. There are some forms and worksheets that can make your life a little bit easier, like forms you can use to make notes of medications and supplements you've tried. That way it's easy to just print a copy and take it to your next appointment. There's a total of 6 different forms you can download and use. Just go to today's show notes and click on the link to download a free copy of Take Back Your Life and download the bonus resources. Go to fibromyalgiapodcast.com/105. We'll also have all the links where you can check out Dr. Chadwick's work and swing care. For today's shout out, I want to share this note that I received from a listener about our new fibromyalgia documentary, Invisible. Invisible is the first comprehensive feature documentary that tells all the stories of people living with fibromyalgia, a condition, as you well know, that many people still don't believe really exists. In the film, they also expose the fight with insurance and drug companies for proper treatment and highlight how access to holistic health and education is often determined by class and money. Through his journey to better understand fibromyalgia as a way of helping his mother, filmmaker Nick Demas finally addresses his own suspicions about having fibromyalgia himself. You'll be able to hear directly from Nick in a couple episodes. I'll be interviewing him for the podcast. This listener, Julie, writes in and says, Tami, I just watched Invisible this afternoon. Unbelievable. I'm going to share this with my family and friends. This documentary is what the world needs to see, to help understand what fibromyalgia is like to live with. Thank you so much, Julie. We are so excited to finally have the film out there where you can all watch it. We've been working on it a long time. And I'm actually in the process of planning a live screening of the film in Portland, Oregon with Dr. Ginevra Lipton. You can sign up to be notified when tickets are available on today's show notes page. Go to fibromyalgiapodcast.com/105. And if you aren't in Portland, don't worry, we've got you covered too. We're going to be doing a virtual screening in tandem with the live event. Again, just go to the show notes page and sign up to be notified when those tickets are available. If you are interested in doing a screening in your own town, that is totally possible. We are excited to now have a way for you to book community screenings. Whether it's just a few friends in your living room or a support group or public event, or even a virtual screening. You can even book an option to schedule me or the other filmmakers for a Q&A panel or to speak at your events. We'll have a link to schedule those community screenings on today's show notes page. Just go to fibromyalgiapodcast.com/105. See you next time. And that wraps up another episode of the Fibromyalgia Podcast. I'm your coach, Tami Stackelhouse. For daily doses of hope, inspiration, and practical advice, come hang out with me on Facebook. Visit facebook.com/fibrocoach to find my personal coaching page and connect with me directly. To find the show notes, additional resources, or to schedule a consultation with me or one of my coaches, visit fibromyalgiapodcast.com.